A very good afternoon, ladies and gentlemen. Once again with Kuntup. Kuntup, he is here with one of the health worker who's present here in this 2 days workshop here in the Seed Convention Center, which is behind the Panwood Hotel. And he'll brief us about his experience, his 2 days experience here in this workshop about the neurodevelopmental disorders.
My name is Truman alias Basayomoy, and I work as a psychologist of the District Mental Health Program East Khasi Hills, and my place of posting it's in Mimhans, Laumali, Shillong. So basically, I'm here to talk about the experience regarding the 2 days workshop, an intensive workshop on neurodevelopmental disorder. And I think for me, as a professional health workers and working as a psychologist, I think these 2 days workshop has tremendously helped me in capturing the whole idea and more concept about how these neurodevelopmental disorders they come into picture. Not many of us realize the need and the importance of taking proper care, taking proper intervention relating to these neurodevelopmental disorders, because these neurodevelopmental disorders, when we talk about it, not many people would really understand in understanding the importance of the screening part. Yes, we will be able to identify if the child is a little bit different, if the child is a little bit completely different from the social work, not being able to have the reality contact and so on and so forth. So based on that, I think these 2 days workshop with a mixtures of group coming from the education department and coming from various other departments, it has helped us to work together, to be able to join hands together so that we will be able to to fulfill the needs and the requirements of all these children or of all these individuals suffering from the different types of neurodevelopmental disorders. And to name a few of these neurodevelopmental disorders that we have studied along the way, one is on a very detailed autism spectrum disorder. Then we will be learning a lot on the intellectual disabilities, on the specific learning disabilities, as well as on the ADHD, which is also very common among children. So therefore, being part of this workshop, I think it will really help us, and also for the viewers who are watching this TV news channel, they will be able to understand where to get the right kinds of treatments and intervention. Because with these neurodevelopmental disorders, a lot of these people, they still believe, because they still believe that it's purely stigmatization and it's purely being discriminated. They do not believe that it's actually an illness. They always thought that it is more of capturing by this what we call a social evil and all of that. So they need to get rid of these stigmatization and discrimination, but getting into the right track of understanding that when we have these kind of children, or when we have these kind of individual suffering from different types of these disorders, they need to get the right kinds of treatment and they need to get the right kinds of intervention so that they will be able to cope up with their day-to-day activities accordingly.
So this workshop mainly, like he said, it's going to look at neurodevelopmental disorders. So far we've covered autism spectrum disorder. Later on we'll be covering specific learning disability, intellectual disability, and also your ADHD, your attention deficit hyperactivity disorder. So like I've said, so far we've covered autism spectrum disorder. What I like about the workshop is that every time, as a professional, we're always talking about this transdisciplinary approach or this holistic approach in which we're trying to bring in the professionals from different fields to kind of collaborate and, I don't know, maybe come up with a better intervention for such individuals. So this workshop is doing that by bringing out people from different fields, from the education, from the health, from the social welfare department. So this kind of transdisciplinary approach is we are starting to see that happening through this workshop.
So as a clinical psychologist, have you ever encountered in your daily work?
Yeah. So my job mostly is in assessing these individuals with disability, but this intervention has kind of helped me in terms of how do I then intervene after the assessment. So after the assessment, what do I do for them then?
Regarding this workshop that we are having for 2 days regarding neurodevelopmental disorders, it's a very informative workshop that we are having. I would really like to thank the government that has taken up this initiative for having this workshop, and especially for us health workers who are in the field, it tends to give a boost especially for us regarding so many types of therapies that we need to do regarding this children or the adults or the adolescents which encounter with this neurodevelopmental disorders. So from my perspective as a physiotherapist and even let's say therapy, so there are so many types of therapies that we need to inculcate. We need to work together. It's not just like a single therapy that will work out, because there are so many types of this neurodevelopmental disorders. It's not just one. It's like most of them they might have a combination, maybe or two or three. But let's say like when we come to a therapy point of view, it's we have to work together. Let's say with a speech therapist, with a behavior therapist, then also with other specialists or psychiatrists, then or developmental pediatrician. There are so many holistic approach that we really need to come across. And with this workshop, this 2 days workshop is like we are having so many people from and so many departments participating, and especially like from the education department. And if we see like for this type of children, they do really need some special, so to say, like a special setup, especially for them. Even though if we can have an inclusive school where all of them they can mingle along with the normal children, which is needed, and also there are some children which need special attention. So far in our state, we really do lack those type of schools or institution from the government sectors. The only thing is that we have is from the private sector, and private sector how much they can accomplish. And with the current trends, like especially if we take autism, like with the current trend now, every single child or any autistic child that has been diagnosed, the ratio is 1 to 36. So if we say one child in every 36 child is an autistic child, that is a very huge number. Whereas when they started, so to say, like to find out like how many autistic children are there in the country, the ratio was a huge number. So it was around 1 to 4,000. So now it has come to 1 to 36. Then I do feel that we, through this workshop, we can identify more, we can help more. So, and we need to have a good holistic approach where we need to combine the education department, the health department, and all the departments which can involve in helping out or neurodevelopmental disorder children. And one thing I would like to just end up is a child, when we teach them, he might not understand. Maybe if we try to understand how he learns, then maybe that would be a very good approach in teaching him. Because this type of children, there are some of them, they are very, so to say, very intelligent, very brilliant. So we need to really capture like when they are still young and start a proper intervention, so that when they grow up into adolescents and into adults, they can be independent on themselves. So there are some cases where they might not be, but some cases, especially with autistic children, so these things it can be looked into it.
My experience in this workshop is that this workshop has helped me to learn a lot about more about autism spectrum disorder. It has learned me how to screen, identify with the intervention, and then with the skills that we have to carry out in the field as a psychiatric social worker.
As a psychiatric social worker, have you ever encountered or experienced this kind of symptoms?
Yes, we have a lot. We have a lot actually, and in Meghalaya, I wouldn't say in Meghalaya, like I wouldn't say like majority, but like through my experience that I have encountered, like they used to be confused what is mental retardation and autism. So the autism, once the parents they notice the delay in their milestones or anything, they will be confused about the whether it's mental retardation or autism. So that is the experience I have encountered. So what we used to do is, once we know whether it's a intellectual disability or whether it's autism, then we psychoeducate them. By psychoeducation, we means we educate the parents about the nature of the illness, the symptoms, and what are the management or the skills we can educate them so that their children won't be, when they grow up, they won't be dependent on their parents and it won't be a burden to them.
Thank you so much. Thank you so much.